Hi guys, this is Dr. Anna and welcome back to my channel. So in this video, I am going to be speaking about hand hygiene and how to maintain your hand hygiene. And in the end of the video, I have a small clip where there is a demonstration about proper hand hygiene technique. So yeah, keep watching. So with the outbreak of this coronavirus, or also called as COVID-19 virus, as we can see everywhere that fear of this virus is spreading more than the disease actually, and we can see people going insane. They don't know what to do, and people are stocking their house with mouth masks, and we healthcare providers are running out of mouth masks currently. So in the past few weeks, with the increase in number of cases, we are conducting meetings everywhere in our school, colleges, and also in office about the preventive measures, and they are mainly focusing in this hand hygiene. But how many of us exactly know what is the correct hand hygiene method, and how many of us, even after knowing, we follow the proper hand hygiene technique? And why we are focusing so much in this hand hygiene? What is the importance of this? So hand hygiene is an easy yet an essential way to stop bacteria and germs from spreading, and also it is considered as a primary measure which is proven to be effective in preventing various kind of diseases. Here are the few facts related to hand hygiene. So the number one is, did you know that globally only 1 out of 5 people wash their hand after using restroom? Do you believe that? Next is, average office worker tend to come in contact with around 10 millions of bacteria every day. Number 3, an estimated 61% of healthcare professionals do not wash their hands correctly. Number 4, 50% of hospital acquired infection can be easily prevented with better oral hand hygiene. Number 5, so our little pretty dirty hands can transfer viruses to 5 surfaces and 14 other objects. So guess the power of dirty hands. Damp hands spread 1000 times more bacteria than dry hands, so keep your hands clean and dry. Bacteria can stay alive on our hands for more than 3 hours. So next is how many times we are supposed to wash our hands. So I'll explain for healthcare professional first. So I found this chart hung on the wall in my department, and it was from WHO, and it says 5 moments for hand hygiene. So the first is before touching a patient, the second is before performing any aseptic procedure, third is after any body fluid exposure, and fourth is after touching a patient, and fifth is after touching patient surrounding. And for others, and also obviously for healthcare professional, we should always wash our hands before eating. And as an Indian, we all know that this work as a spoon, fork and knife as well, so we should take extra care of it before using it, and also after using restroom and after visiting any public places. So there are different types of hand washing techniques. So the first one is with soap and water. The soap here is not antimicrobial soap which is used, and it is mainly done to remove soil or any transient microorganisms from your hand. And the next is antiseptic hand washing technique, in which you use antiseptic soap or liquid to wash your hand. And the next is, as all of you know, with the help of sanitizer, that is alcohol based hand rub. And the final one is aseptic hand washing technique, that is mainly done by surgeons before they carry out any surgical procedure, and it is done with the help of antiseptic rinse such as betadine. Now the question here is whether hand sanitizer is as effective as hand washing. So hand sanitizer containing 100% of alcohol can kill most of the germs, including various kind of bacteria, spores, but not all kind of viruses, because hand sanitizers are proven to be not as effective as hand washing when it comes to viruses, and also it is not effective when your hand is soiled or dirty. So now Dr. Kavya, who is posted as an intern in our department, is gonna demonstrate hand washing technique for you guys, so keep watching. So this is the hand washing area in our department. So the first step is to wet our hands with water. Never use hot water for hand washing. Apply enough soap to cover all the surfaces. Rub hands palm to form thick lather. And keep your right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Rotational rubbing of left thumb clasped in right palm and vice versa. Back of fingers to opposing palms and with fingers interlaced. Rotational rubbing backward and forward with clasped fingers of right hand in left palm and vice versa. Rinse your hand with water. The whole procedure should last for 1 minute with each step for 10 seconds. Close the tap with the help of disposable tissue paper. If dryer is available, you can use dryer to dry your hands. Dry your hands thoroughly. Dry all the surfaces. And if you don't have dryer, you can use disposable tissue paper. Then you can also use hand sanitizer in the same way, and you should follow all the same steps, but only thing is that each step lasts for 5 seconds here. This is it for today's video, guys. I hope you enjoyed my video, and if you think my video was useful for you guys, please don't forget to give a big thumbs up, and if you haven't subscribed to my channel yet, please hit that subscribe button right below. And I want to extend my special thanks to Dr. Kavya for demonstrating hand washing technique for us, and also I want to extend my heartfelt gratitude to Gautam sir for letting me shoot the video in the department. And yes, I'll see you guys in my next video. Until then, take care. Bye bye.